Hello everyone, welcome to this lecture on Introduction to Medication Safety. My name is Dr. Rosemary Lim and I'm really excited to talk to you about medication safety. Learning outcomes for this lecture. I've divided this lecture into 3 parts, and in the first part we are going to explore what medication error is and why. Why do we need to study medication error? In the second part, we begin our journey exploring how we can tackle the problem of medication error. And we're going to talk about a just culture. We continue that in part 3, where I introduce incident reporting as one of the key strategies that's used across the world, actually, to learn about errors. And lastly, I will briefly discuss what a human factors approach is and why I think it's really important that we use this approach to study medication error. So I hope you have had the opportunity to watch Paul's story. And if you haven't, please pause this video right now and go and watch Paul's story. Paul's story is really one of the primary reasons why me and a lot of researchers continue to do research into medication safety. The kind of problems that keep happening within healthcare again and again. And really, this is heartbreaking. Paul's story, unfortunately, is not in isolation. There are many other patient stories as well. And here are just a few. This lady is called Ursula Sampson. She was an 80-year-old who had pneumonia. She was given 10 times the potassium chloride that she was prescribed, and unfortunately she had a heart attack and she died. Some of you may know this person, Wayne Jowett, the famous case where he was given the cancer drug vincristine via the wrong route. So this drug was supposed to be given via the veins, but it was given via the spine instead. And unfortunately, Wayne died. Twin babies of the American actor Dennis Quaid, they were inadvertently given adult doses of heparin. Thankfully, this was reversed with protamine and they recovered in ICU within 48 hours. Matthew Young, the baby who was prescribed peppermint water for wind, and pre-registration pharmacist Zaid Khattab dispensed it undiluted. Unfortunately, Matthew died in hospital, aged just 3 weeks old with severe brain damage. These stories are really heartbreaking, and we continue to see these stories again and again in the news. And multiple reviews have been conducted to try and understand why these problems have happened, why these errors have happened, and to make recommendations. And this slide just shows some of the reports that have been published in the last few years. And really the common thread across them is the need really to increase transparency and honesty, to being open to talk about errors so that lessons can be learned. So when we talk about medication error, what do we mean? You might have heard multiple terms being used that are quite similar. So it might be medication error, it might be medication safety, and certainly these 2 references that I put on the slide here just demonstrates the many different ways to define medication error or safety. So which one have we chosen? So I've chosen to use the Department of Health's definition of medication error. And this definition is any preventable event. So anything that can be prevented that may cause or lead to inappropriate medication use or patient harm while it's in the control of the health professional, the patient, or the consumer. So there are lots of different problems with medication, isn't it? So you might have heard of the term adverse drug events, adverse drug reactions. I think you will have, or you have already had a lecture on adverse drug reactions. You'll probably also have another lecture on adherence problems as well. And then there's medication errors. There's lots of different terms being used here and different issues related to medicines. And this little figure here just shows you the interrelationship between all of them as well. And I think suffice for what we're covering in this lecture, it's anything that it's really, it can cover adverse drug events and also adverse drug reactions as well. So it's really anything that's gone wrong with the use of medications. And why do we need to study medication errors? And this slide here just shows you some figures. So around 20% of people over 70 years old take 5 or more medicines. And this is just continuing to increase with the aging population, and more people are having chronic medical conditions as well. So we're looking at an increasing population with multiple drugs, taking multiple drugs, and you might have heard of the term polypharmacy. So figures here on the left-hand side of the slide, 600,000 non-elective hospital admissions are due to medications, and 70% of these are preventable. This slide also shows us the 5 classes of medicines that account for the most admissions. So right at the top is non-steroidal anti-inflammatory drugs, and then the next one is antiplatelets, anticoagulants, etc. So that's the hospital side. What about, let's look right in the middle of the slide here, where figures have shown that around 1 billion prescriptions are issued every year in primary care. And of these, there are 50 million prescribing errors, and up from between 400,000 to 33 million dispensing errors. So we're starting to see, this gives you a flavor of the extent of this problem as well. Let's look at the right-hand side of the slide. Again, 2.5 million doses of medicines are administered in hospital. And of these, around more than 200,000 have errors in them. 500,000 inpatient prescriptions are used within the hospital. Again, lots and lots of prescribing errors as well. So we're starting to see a picture of the extent of the problem. This is another slide that just gives you a snapshot of the total number of errors that happen. So this slide was published in the pharmaceutical journal. So this infographic is published there in 2019. So this stats is up to date until then. Total errors 237.4 million. It's a really large number, and it just breaks down. This slide just shows the breakdown of different errors in different settings. So in primary care, in care homes, in secondary care, i.e. the hospital. And then on the right hand side, the types of errors as well. So there are prescribing errors. There's another term there, transitioning errors. So this is when people move from one setting to another setting, the common dispensing errors, and a large number of administration errors as well. So lots and lots of errors happening, unsurprisingly, and it costs the NHS a lot of money. So why do we need to study medication errors? It's not just the economic cost. It costs a lot of money, but also there is a burden on the NHS. There is an emotional burden as well on families and patients themselves as well. So there are lots and lots of reasons why you and I should study medication errors. And certainly across the world, the WHO, the World Health Organization, has put an emphasis as well on medication errors. So they had a medication without a global patient safety challenge, medication without harm, and it aims to reduce severe avoidable medication-related harm by 50% globally by 2022. And within England, there is the Medicine Safety Improvement Program as well. This program is ongoing, and several recommendations, several kind of actions, focus of this program include improved shared decision making across patients, carers, and also health and social care professionals. These are just a few that I've put down. Improved shared care between health and care professionals with increased knowledge and support, encouraging reporting and learning from medication errors, and also encouraging and supporting patients and families to raise any concerns about their medication. So here are just some high-level initiatives that we should be taking note of. So I think it's time for us to just take a short break. I think what we can do right now, I hope you can just go back and look at some of the slides, look at the slides that have been presented now, consolidate what you have learned. So what is medication error and why do we need to study medication error? And I think the really important thing that I want you to reflect on is to think for yourself, why do you think you need to be studying medication error?